Hey, we're back. I am Ashley LaRoche, one of the doctors at the Animal Hospital of Statesville, and this is our excellent public relations person, Kyle.
Whatever I am anymore.
Longtime employee. We are here for one of our Lakeside Chats, probably one of the last ones before it gets cold and dark, to talk about something we see commonly and people may have experienced at home, disc disease in dogs, so intervertebral disc disease.
IVDD.
Yes, IVDD,
sure.
Yes, absolutely.
So what is IVDD?
So the discs, every species, warm-blooded mammal anyway, has in their back little warm spongy things that basically cushion the spinal cord during movement. And so what happens is over time, just degenerative processes, these can rupture or ooze. It happens in humans too. But we have some dog breeds that are a little bit more prone. So.
Okay, and what dog breeds are they?
So our chondrodystrophic breeds. So basically your dachshunds, your corgis, your French bulldogs, your basset hounds. Basically the genetics that breed short legs and long backs, those dogs are more prone to very early disc degeneration. And then over time, during subtle movement, they are degenerated enough that they can rupture.
So what are the symptoms of IVDD?
So it depends on kind of how bad the disc rupture is and kind of where it is. But initially you'll have pain. Sometimes it can be some subtle back pain, sometimes arched back, walking with a kind of gingerly with all 4 feet and an arched back. Sometimes affected dogs can be lame on one leg or the other with it as well. Sometimes they'll stop eating. Sometimes they'll even cry out in pain. And sometimes they just kind of don't feel well and don't want to jump up anymore, is like a big sign that could be indicative of disc disease.
So how do you diagnose IVDD?
So usually we're looking at the breed. So if I have a dog that seems painful and it's a long back dog, I'm going to be thinking of that pretty quickly. So we do a physical exam and we palpate the spine, and usually we can pretty quickly locate where that pain is.
Is that where you go each individual?
Yeah, we pinch the spine. In the cervical neck, we'll put that neck through a gentle range of motion. IVDD in the neck is horribly painful for most dogs, sometimes much more so than in the mid-back regions. So we'll be looking for any response, and usually they cry or whimper or something like that. So, and then we'll eventually take some survey x-rays. Sometimes we can see signs of it on an x-ray. We can see changes in the disc mineral in some cases. Sometimes I can see a narrow disc space. That gives me a clue that maybe that's happened in one of these guys. Ultimately, it's an MRI or advanced imaging diagnosis, though.
Just like when with people, they see the soft tissue on those better, right? So what are the treatment options? So
the treatment options, most of the time, eventually it's a surgical disease, but sometimes with really mild cases, we'll treat medically, and that usually is anti-inflammatories and pain management, and then kind of rest, not necessarily total confinement, but we're going to stop that dog from, kind of flying off the porch, playing frisbee, those sorts of things, and just have some controlled walking and stuff like that, like out to go potty and things like that. Oftentimes the signs will be recurrent, just because that dog has a tiny piece of disc material that's ruptured. Subsequent swelling happens in the tissues around the spine that cause a lot of pain. So we're taking care of that. The swelling's going down. Those dogs feel a lot better, but that piece of disc material is still there. So until you surgically remove it, it could be a problem later on.
Okay. So surgery isn't always necessary, but it usually ends up that way.
Correct. Yeah.
It's not a permanent treatment.
Right. That's right.
Okay.
And so surgery, usually we recommend that for dogs that have a recurrence in their IVDD and it's, worse than the original insult. Dogs that are so painful we can't control the pain, or dogs that have neurologic deficits. So what happens is the disc ruptures and it compresses some of the spinal cord. And so basically the back legs they'll start to kind of stagger and sway, and then sometimes start dragging themselves because they become partially paralyzed. And so basically those dogs that are progressing through that continuum, those dogs really need surgery sooner than later. Sometimes it's even an emergency if it progresses very quickly.
What's the recovery process like for medically managed dogs and surgical dogs?
Medically managed dogs, depending there again on how severe it is. The minor cases, I would say 75% of them improve. The more severe cases, usually what happens is the more disc material that's evulsed into the spinal canal means the more severe the signs are going to be.
Right.
So the more severe dogs, and more severe oftentimes is partial paralysis or paresis. I think it's like a 50-50 for those dogs.
Even after the surgery?
No, without surgery.
Without surgery. But after the surgery?
Surgery, like a 90%.
Oh, that's good.
Yeah. If you're a long back dog, so the exception to that can be French bulldogs. They have not only degenerative discs, but they also have some malformations in the spine. So they don't have a lot of those Frenchies do not have the spinal support that other dogs do. So they are very prone to recurrence even after surgery. So like 50% of those dogs, if they have to have surgery for disc disease, need another surgery or multiple surgeries. So yeah, spinal disease in the French bulldogs can be really complicated and
they have
not
quite a few issues.
Yes, they do, and not as straightforward as the typical dachshund or corgi or something on that order.
Are there any long-term effects if a dog has IVDD?
I would say some dogs have some permanent slight neurologic deficits. Unfortunately, there's 7 cervical discs that can be compromised in the neck, and then 7 lumbars. Mm-hmm. So the possibility that they could have disc rupture in other areas is possible later on. And it's not complication from that surgery, it's just the nature of the condition.
Is it kind of like knees? If they have one, they usually end up with another one?
That's right. But some dogs have like one, dachshund has one surgery. What they usually do is they'll try and fenestrate the discs, they're called, and it's a preventative surgical procedure to prevent that from happening in some of the other discs, but unfortunately it can still happen.
Can you explain fenestrate?
So I believe what they do is they go in and kind of basically allow some extra, they go in and leave some extra wiggle room for the discs, I believe, is kind of a way of saying it to the surrounding discs.
Squashing down.
Yeah.
Okay. What can I do to help my dog if they have IVDD?
Well, you'd want to get them seen, and basically, these may be dogs you don't want them to, do like a lot of high jumping athletics and things like that, but you want to get them seen, and depending on the severity, get them on some medications, and then just be kind of, knowledge is power, be aware, that it could progress, and if we have progression or recurrence, consider, referral as well. And it's not an option for everybody. It's a hugely expensive, a hugely expensive option. By the time you get your MRI and surgery, you're looking at thousands of dollars. Some dogs need rehab, so.
And that might be a further inducement to purchase insurance for those breeds of dogs.
Yeah, that's it.
So,
that's it. And start them very young. Degeneration can start really young in these guys. So, for sure.
So how do I manage my dog's pain with IVDD? You mentioned some anti-inflammatories, NSAIDs?
Yeah, we start with NSAIDs a lot of times. And then sometimes if it's particularly neck signs in the neck or cervical area, we'll do muscle relaxants because those neck muscles are just spasming, making things worse. People have that back spasms a lot of times. And then sometimes gabapentin or Neurontin. And in some cases, particularly if I have a dog that maybe isn't a surgical candidate, sometimes that's due to age. There's a variety of reasons for that. Other comorbidities or problems. We'll kind of go to some prednisone or corticosteroids. The outcomes tend not to be any different than using NSAIDs, but it's definitely, I feel like, a tad more effective for pain. So
how can I prevent IVDD?
You really can't. Yeah. So I guess
put your dog in a straitjacket.
Yeah.
Right?
Don't get you would have to avoid the long back dogs. And that might be a conversation, with a breeder. Like, historically, do you have feedback on dogs that have problems with this? Maybe you'd get lucky and not have a line of dog that doesn't have early and severe degeneration of those discs. But ultimately, it's not a lot of great preventions. I would say in some that are high risk or have had disc signs before, maybe using some common sense about the kind of activity that they do. So.
It's kind of like lifestyle changes. What lifestyle changes should you make? Don't let them jump off the couch. Don't let them jump off of the bed.
Don't let them get obese.
Yeah, and don't let them get fat.
That's a big one, yeah.
Obese, excuse me.
Yeah, overconditioned, yeah.
Yes, overconditioned, underconditioned. Is what I
yeah, they just load everything when they're so much more load, the heavier that they get, so.
Steps okay?
Yeah, steps are okay, yeah. I would say if you've had a dog that has had disc disease in the past, it may not be a bad thing to consider a ramp if they'll use it. Like mine won't use it, so.
Mine goes down the ramp until the end, and then it's like, whee! Yeah. Off he goes. And I think you answered this, but just to further emphasize, IVDD can recur, correct?
Yeah, it can. Yeah, it can.
And
I would say that a vast majority of the typical breeds, like the dachshunds and stuff, I don't know. I feel like most of them don't. The French bulldog is, kind of a wild card. They tend to recur, but they have a lot of different issues. So
if you suspect your dog has IVDD, would you consider it an emergency that they need to be seen, or you just know they're really painful and
right?
It's the kind thing to do. Is to get them
right.
as fast as
Yeah, if they're yelping when you touch them at all, I would say that's an emergency. They need to come in. If you notice the gait in the back end, the way they walk is off, that's an emergency. Or the front end too. They probably need to be seen. And if that's an ER visit, great.
Yeah.
If they're just minorly painful and it doesn't seem to be getting any worse, it's probably okay to wait till morning, but if any questions at all, I would just take them, before they progress. And then if they progress rather rapidly, those dogs oftentimes are heading towards surgery, so.
I know I've had degenerative discs from my fracture when I was young, and it really, really hurts. So I would get them help as fast as you can. And I mean, I've never had to have surgery or anything. Thank goodness.
It's misery. So yeah,
it hurts. Are there any specific exercises or therapies that they can do to prevent the IVDD? Or
no, not really. Besides keeping good muscle mass, so that's just controlled exercise. Yeah, and then obesity prevention. Those are going to be your two big things, and particularly corgis. They tend to be so prone to obesity, and so a lot of dachshunds too, because they're good food beggars. But making sure they're not sedentary, obese dogs probably are your best things that you can do.
Are there any other points that you've covered in your notes that I haven't asked about, or?
I just say the worst sequela to this is when the dog becomes paralyzed and loses deep pain, it's called, so they can't feel their legs at all. Those cases sometimes don't do so great with surgery because it's just, the most advanced spinal cord damage. It basically is akin to a transection. Those dogs eventually sometimes can need a cart, and every dog and every owner is different on whether they can deal with that. Yeah, so some dogs need their bladder expressed. That can be really hard. the environment sometimes is not suitable for a cart, or the dog just doesn't do well in a cart. So that's kind of probably, that's why we always encourage getting these dogs seen earlier than later, just because we're trying to avoid that end. And sometimes, despite our best of efforts, it happens. But
I can say that the smaller dogs, it seems like most of these happen to smaller dogs, like you said, the long back dogs, their little carts fit through things. Like when I had Kaylin, and she had a cart because she had osteosarc, and it wouldn't fit through the door. So it was hard to get her out the door, so you had to wait till you were outside to put it on her and everything. So at least there's that. If you need to have a cart, you should be able to let them run around in the house with it.
Yeah, so, on like multi-levels, and or a big dog just where it's really physically hard, to move and stuff like that. And you got older people, and there's just a variety of reasons. So it's just a decision. Like, you end up having, it's basically a conversation between your doctor, you, and your dog, and what's going to be best for you. And some dogs, frankly, don't do as well. They don't have that drive to motivate in a cart, and are kind of very anxious and anxiety ridden. And a lot of dogs, when they can't move, period, they don't understand, and they get very anxious.
Well, kind of like people. Some people handle diversity. What was I trying to say? Something
disability. Disabled.
Adversity. Adversity. There we go. Some people handle that, just with courage and just move on and excel, and others just
right. And if you get kind of a grumpier dog, or just trying to get them in and out of the cart, and they're trying to bite or something, that's not a great quality of life for either party. So,
but like you said, it's between you three, the pet, the vet, and the person.
Thank goodness over the years, I think I've only had 2 or 3. I've been doing this for like 30 years, like 2 or 3 cart dogs, I mean, there's more out there, of course, but for the most part, it doesn't end up being that. So
that's good.
So,
you think to wind it up?
No, I think that about covers it. So if you have a long back dog that's acting kind of funny, it could be disc disease. So have us take a look at it, and maybe we'll tell you it's not, and that'll be a good thing.
Well, we do not do that surgery. Correct?
We do not. That a neurologist needs to do that. They have to do an MRI to see how much disc material and where it is first, and then they have to go in and they actually remove like a piece of the vertebral, basically a part of the vertebral body, to vent the spinal cord, basically to alleviate pressure and remove that disc material. And then, they'll go in and make alterations to the other discs around them to, maybe prevent them from having the same thing. So there's hope, and there is things you can do to help your dog avoid these problems, but it's not 100%. Right. And as an aside, like the large breeds get their own version of disc disease. It's definitely not like this. They get they're a little bit older, and they get kind of a slower, more progressive oozing of the disc, which is probably what happens with people a lot of times. The outer portion of the disc degenerates, and then it kind of just stretches out and slowly compresses. So they can get things too, but it's usually not as dramatic or as common, I would say, as the smaller long back dogs. And that's why we kind of focused on that, because that's what we typically see.
Can this be bred out of dogs?
I suppose it could be, but it's been around for a long time. So I think it's, to find a mode of inheritance, and they kind of know, I suppose, it's linked, to how they're made, kind of. So I think it might be kind of hard for them to do that. So just decreasing the incidence of early age disc rupture by keeping good records, and, maybe selecting out individuals. And I'm not sure, my colleague would be a good one to ask about that, like where the genetics are as far as breeding. Breeding, looking for disc disease and lines and things like that, if they're even doing that right now. So I
think they are, because I have a Catan, and they've done that with them.
Oh, great. So that's awesome. Yep.
It happens.
Yeah.
Well, so like she said, if you think your dog may have any kind of pain that you don't know exactly where it comes from, idiopathic or whatever, especially in the neck, the back, the legs, the forelegs, come get it checked out. It could be very painful for your dog, and we may be able to help.
Right. We may have management options for you later. So,
okay.
Yep. All right.
Thanks.
Bye.
See
Till
y'all
next time.